As of August 11th, we are aware of 425 confirmed cases of COVID-19 for First Nations on reserve. Of these cases, 34 are being hospitalized and 393 have now recovered. There is also a total of 17 confirmed positive cases in Nunavik, Quebec, all of which have recovered. Today, as we continue to navigate this pandemic and to keep Canadians safe, I'm pleased to announce that Indigenous Services Canada will provide $305 million in additional allocations to communities from the Indigenous Communities Support Fund. This funding will provide crucial support to key community initiatives that strive to prevent, prepare for, and respond to COVID-19 in First Nations, Inuit, and Métis communities. It'll be distributed through a combination of allocations directly to First Nations, Inuit, and Métis leadership and needs-based funding that will be application-driven. This approach aligns with our commitment to support Indigenous leadership's approaches to community wellness while providing the flexibility to respond to emerging needs, for example, in response to an outbreak of COVID-19. This is something we have heard directly from Indigenous communities. We had recently been quite worried about the spread in Haida Gwaii. Whenever you see numbers starting to go up, these things can go exponential quite quickly. As always, leadership on the ground has reacted tremendously through basic hygiene protocols that we've been stressing from the very beginning, and we are cautiously optimistic about the developments in Haida Gwaii. It's a very sensitive area in terms of its ecosystem, in terms of its peoples, and it is an area that is very, very vulnerable. Because in part of its remoteness, but also because of its exposure to tourists. This is a worry that we see when we talk about second waves or third waves, the progressive openings and staged openings in provinces to the economy, people letting their guard down.